get settled in and then I'll do the intro.
Sounds good.
Hello to those who have just joined us. Just going to give it another minute for others to get online and then we'll get started. Okay, well, I guess we'll get going with the introductions and maybe others will join as we're going along. So hi, everyone. My name's Fiona Lewis, and I'm pleased to welcome you to this webinar hosted by AMAC. As many of you know, AMAC is a leading funder of research into bone marrow failure diseases in Canada, and our organization supports patients and caregivers across the country who are living with aplastic anemia, myelodysplastic syndrome, and PNH. So I'm the patient support liaison for BC and Alberta. And before I introduce our speaker, I just want to familiarize you with some of the features of the webinar platform. If you hover your mouse near the bottom of your screen, you will get a menu that pops up. And there's a few options there that you can use, including the raise your hand feature, the Q&A box, or the chat window. So you're welcome to write either questions or comments in the Q&A section or in the chat. And most of those we'll answer at the end of the presentation, unless they're really relevant to what's being talked about, and then I may interrupt and we'll deal with the question at that time. We are going to mute all the lines during the presentation to minimize the background noise, but we can unmute it at the end if you'd like to ask your question verbally. So I'm really pleased to introduce Nikki Stiver to present today's webinar, which is entitled Nurturing Your Holistic Wellbeing, the Psychosocial Impacts of Living with a Chronic Illness. Nikki holds a master's degree in social work, in addition to a postgraduate certificate in workplace wellness and health promotion, and a Bachelor of Arts degree in psychology with a minor in family and child studies. She currently works as a registered social worker in the daycare unit of the Leukemia and Bone Marrow Transplant Program of BC. Before joining the LBMT, Nikki worked for an employee and family assistance program, first as a health promotion specialist, creating customized psycho-education workshops for various organizations, and then as a mental health clinician, providing individual and crisis counseling services across the country. Her clinical and research interests surround promoting holistic well-being and patient empowerment, preventing mental health concerns, and raising awareness about support services, especially for those living with a chronic illness. Nikki moved to Vancouver, BC from Guelph, Ontario last year, and in her spare time, she enjoys spending time outdoors, specifically hiking, bicycling, yoga, and running. So, as mentioned, please enter your questions into the chat as we go along, and then I'll read them out for Nikki to answer at the end. So with that, I'll turn it over to her to begin the webinar. Nikki?
Perfect. Thank you so much for your introduction, Fiona, and welcome everyone. It's a pleasure to be here today and to give you a little bit more information of what are the psychosocial impacts of living with a chronic illness. Specifically, we're going to be taking a look at a lot of the blood-related diseases like aplastic anemia, MDS, and PNH. But all of these things that we're going to be talking about are going to go into a little bit of really just looking at our holistic well-being, regardless if you have that chronic illness or not. So hopefully this will be able to provide you with some education and some guidance in terms of just how can we take care of ourselves. So our objectives today is just increase our understanding and knowledge around chronic illness through a holistic lens. What is the term psychosocial? What do we really mean when we're talking about psychosocial impacts? And specifically into the 7 dimensions of well-being and how they are influenced by bone marrow failure disease. Once we kind of build this knowledge and build this understanding, we're going to take a look at how can we really apply these techniques. How do we kind of move forward and actually use what we're learning today? So again, we're going to be talking about just looking at a holistic point of view, what is meant by psychosocial, what is meant by the 7 dimensions of wellness, and then discuss some tools and resources, how to self-assess, self-manage, as well as self-advocate to optimize our holistic well-being. And then as Fiona mentioned just earlier, I'm going to have about 10 minutes at the end to ask any questions that you have regarding application or just knowledge and understanding there. So to dive right in, when we talk about looking at any kind of illness or therapeutic issue through a holistic point of view, we're really looking at what is just beyond just our physical selves. How are our illnesses and therapeutic issues, how do they go beyond those physical symptomologies that are associated with it? So all of any kind of illness or therapeutic issue really involves a variety of different elements, which do require then a variety of different perspectives and a variety of different treatments in order to address really the issues that are at hand. So one thing that I want to kind of point out of just how to look at something a little bit more holistically. So there is the Indian parable known as the blind men and the elephant. So I don't know if any of you have heard of this parable, but it's a really interesting approach of looking at things through a holistic point of view. So how the parable goes, there's a variety of different ways in which this story has been told throughout the years. But one of the stories is that there were about 6 blind men, and they were each kind of positioned at an elephant at different kind of points. So one was situated at the trunk, one was at one of the front legs, one was near the stomach and abdomen area, the other one by the tail, and the other one by the tusk. And then, the last one right by the ears. So each of the blind men were assigned to just describe what does an elephant feel and look like based on their perspective. So the blind man that was by the trunk was feeling the trunk and saying, oh, well, an elephant is like a snake, feeling that the long trunk. The other blind man that was situated by the tusk was saying, no, an elephant is like a spear, it's pointy, it's smooth. Whereas the blind man that was by the tail was looking at it saying, no, it's more like a rope. And so seeing that all of the blind men's descriptions, they were accurate, they were valid, is that they were looking at just one kind of point of the elephant in order to describe it. So this kind of shows that when we're looking at a therapeutic issue or an illness, and if we're just looking at one point of view, like the physical ailments, is yes, that's completely accurate, completely valid of what's going on for you. But taking that step back and seeing, okay, what other perspectives can I look at this therapeutic issue and illness to see it from a different standpoint? So is a illness like, say, the common flu, yes, you have those physical illnesses like a headache, sinus congestion, aches and pains. But if you look at it from a different point of view of, okay, let's look at it from a social standpoint. You're probably not really going to socialize with a lot of people if you're having the common flu. So your social well-being is, well, a cold is like isolation. So kind of looking at it different points of view to say, okay, how is this illness and this issue, how is this really impacting me? And is there anything else that I need to do in order to take care of myself holistically there? So that's kind of what we're talking about when we're talking about holistic lens, is that's what we're kind of geared towards when we're doing any kind of psychosocial impacts or any kind of psychosocial assessment. It's really looking at that intersection and that interaction with social, cultural, environmental influences, all on the mind, body, and behavior. So one way that we can look at this psychosocial impacts and how we can structure it to make it a little bit easier for us to assess of what's going on for us is using the 7 dimensions of well-being. So the 7 dimensions of well-being are physical, emotional, social, intellectual, environmental, occupational, or financial. They kind of go hand in hand, as well as spiritual or cultural. So although we're going to be talking about each of these dimensions individually, it should be noted that they are all interacting with one another. If you impact your physical wellness and well-being, sometimes your emotional and social follow through. And same thing with our social well-being. If that's negatively impacted, sometimes we notice that our emotional and occupational well-beings are impacted at the same time. So even though we're going to be talking about them individually, we need to know that they are such a moving, an active process. So if you impact one, then one is going to be impacted, and that could be negatively or positively. So just to make that note moving forward. So as we talk about starting off with physical, that's usually kind of the first thing that we go to when we think about illness or when we think about a therapeutic issue. We kind of think of really those physical symptoms. And sometimes that is a really good starting point of saying, okay, what am I physically feeling in order for us to identify what's going on? So just as a recap, our physical wellness really encompasses just a variety of different healthy behaviors to avoid any kind of harmful habits and practice activities that support health and safety for our physical selves. So this can include exercise or physical activity, our nutritional health, our sleeping. This also includes our sexual intimacy and our sexual health. It includes reaching out for medical care. Protecting ourselves against our immune system. This is huge now because of COVID-19, not only for those that are living with a chronic illness like aplastic anemia, MDS, or PNH, but everyone is really taking this approach of really protecting our immune system. So hand washing is really up, wearing our protective equipment such as masks and face shields. And also in addition with physical wellness is that we do want to try to avoid misusing alcohol and drugs, as that does have an impact on our physical well-being. So as we look at our physical health and specifically how it's impacted us living with a bone marrow failure disease, these are kind of some of the typical approaches of what individuals notice as an impact. It should be noted that these specific impacts of what is happening for you is really dependent on the diagnosis itself and how it presents for you, the side effects of medications, and so everyone's kind of medications can vary, and how they respond to medications, as well as any pre-existing conditions that are outside of your bone marrow failure disease as well. So these are some kind of typical go-tos that we kind of see from the medical team standpoint of really what is impacted physically. So many experience an increase in fatigue, an increased risk of infection or fevers as well. Loss of appetite, in which following through with loss of appetite sometimes comes with weight loss. Paler than normal skin, muscle weakness or muscle spasms, as well as low libido or sexual dysfunction as well. Just to kind of engage the group of who's with us, is there anything else that you notice of what are some other common impacts on your physical health by living with your bone marrow failure disease. Feel free to use the chat feature. You have the option to either include everybody, so all the panelists and attendees, or you can just message myself, all the panelists. That'll go to myself and Fiona. So if you want to use the chat feature to put in any other impacts that you can see specifically for your physical wellness that have been impacted by your chronic illness, or that you've seen, if you're a caregiver, what have you seen that the person that you're caring for has had an impact with their physical health. So feel free to drop that in the chat. There's, as I mentioned, there's such a wide variety of physical impacts that can happen, and it really depends on those pre-existing conditions as well. And so someone, if they have a history of heart-related illness on top of their bone marrow failure disease as well, that might trickle down into some other ways that your physical health is impacted. So I'm not seeing any individuals commenting in our chat feature, but that's okay. We're going to move on to the other areas of well-being, but we're going to be using the chat feature for any other impacts that you're seeing that you think the group could really benefit from, of what other ways in which your well-being is impacted. So moving on to our emotional well-being. Our emotional wellness encompasses a variety of different healthy behaviors to build and understand our understanding around our own feelings and practice activities that really support the health and safety of our emotional or psychological self. Psychological safety is so huge, and I think it's something that has really been on the wayside of when we think about safety. When we think about safety, we often go, okay, we have that occupational safety, we have that physical safety, and I think sometimes we forget psychologically safety is a real big thing as well. So this can include, in terms of maintaining our emotional wellness, this can include stress and anxiety management, anger management, just overall effective coping with our life's challenges. So all those ups and downs, every day we have those little stressors that come and go, and so how well are you at coping with those little stressors throughout the day? As well as how are you coping with the big stressors and making some big decisions? How have you been coping with those? Some of it is acceptance and forgiveness. And acceptance in a way that isn't accepting that you're forgiving the situation or that it's okay. It's accepting that that is the position that you are in right now. Sometimes what can contribute to negative emotional impacts with disease is when we are fighting it and saying, okay, why is this happening? Why am I stressed? Why am I anxious? Why am I angry? And having that acceptance of, I'm angry, I'm stressed, and letting that be for now. Not saying that it's okay or that it's not okay, it's just living in that moment, that present moment. Another thing that can be supportive of our emotional wellness is counseling and reaching out to others for emotional support. So sometimes that is our family and our friends, so that informal counseling as well as formal counseling as well. Another part is self-kindness and self-compassion. Sometimes we're really hard on ourselves when we have, when we're living with a chronic illness and using a lot of what I call should language of, oh, I should be more energized, I shouldn't be so stressed, I should be strong. And so sometimes of just giving yourself a little bit of self-kindness and saying what I'm going through right now is really hard and I'm doing my best, and my best is really good for right now. So some of our emotional health obviously is impacted with living with a bone marrow failure disease. So these are some of the kind of common backgrounds of what we're seeing that individuals kind of present with around the same time of their diagnosis. Sometimes it's a little bit of a delayed response, but that can include stress, anxiety and depression, fear, anger. Grief and loss is something that's also really big that I think some people, not only on the medical team side, but also on the caregiver and the patient side, is the loss of identity that goes along with the diagnosis, the loss of mobility, and noticing those changes and having a hard time dealing with some of those changes. And then kind of going back with that self-criticism, a lot of that should or shouldn't language as well. And sometimes guilt and shame, sometimes that has popped up as well. Similar to our physical health, some of these specific impacts of how your emotional health is impacted by living with a chronic illness is really dependent, again, on the diagnosis itself. Is this a kind of sometimes with the chronic illness, it's longer term, and so depending how long you're looking at that or what the prognosis is, can impact your emotional health. Again, the side effects of medications can impact your emotional well-being. Specifically, steroids or prednisone can really be something that can influence your emotional regularity and just your ability to kind of cope with those daily stressors. Some of those medications we're just really quick to react, and it just doesn't quite give us that space that we used to have in order to kind of cope with some of those emotions. So you can kind of notice those changes as well. And again, pre-existing conditions. Before your diagnosis of the bone marrow failure disease, regardless of what that disease is and what that diagnosis is, if you had a history of trauma or a history of anxiety and depression, sometimes that diagnosis can exacerbate some of your previous symptoms that you had regarding your mental health. So there's all those different things that can come into play, especially of those that have that pre-existing trauma or anxiety and depression or anger-related concerns, and you've worked through some of those concerns and those issues, and you've developed this toolbox of coping skills. And they've been working phenomenally up until this point, up until your diagnosis, and now you're noticing, oh shoot, I can't use some of those coping skills that I was used to. So for example, if one of your coping skills was that you go to the gym, you go for a really long run, and now that you have this bone marrow failure disease and you're experiencing that fatigue, that increased immunocompromisation status, and so you can't do the things that you used to be able to do to cope. Even if we're thinking with COVID and how that has been a response in terms of our coping skills. Sometimes we're used to, I go to the gym, I go to the mall for retail therapy, I go to see my family in person, and with all of those things being impacted with COVID, we're having to shift what our coping skills are and learn new tools, and sometimes that can be really overwhelming. So it's always looking at how can I build my toolbox of coping skills and saying the coping skills that I used to use, yes, they were helpful at the time, but they're not helpful right now or in this instant. And so what are other coping skills that I can use to really help myself move forward and take care of my emotional health as it's impacted by the bone marrow failure disease? So using the chat feature, feel free to drop any other emotional impacts that either if you're a caregiver that you're noticing the person that you're caring for has experienced that you'd like to share with the group, or if you yourself are worried or you're a patient and you're noticing that is coming up for you. These are just examples of some of the options, and some of them I have left out just to kind of get the conversation going. I see someone has mentioned worry about the future. That can be a big one. Worrying about what the future can bring in terms of your physical health, in terms of your emotional health, in terms of finances. There's so many things that as a typical adult worries about the future that even with this chronic illness paired on top of it can really add to that worry. Yes, that's definitely one of them. Isolation, someone has said. Yes, that's a huge piece. There is a point in which when you're telling your emotional support system or your network, so that can include your family, your friends, your colleagues, your medical team, of saying what you're going through, and you can only listen so many times of someone saying, I understand, I completely understand, but if they haven't been through what you have been through, then it doesn't quite feel as genuine. So isolation can be big, especially now during COVID times as well, of just our interaction and how we communicate has just really shifted, and so that isolation piece can be huge, of course. Another person said, worry that I may not be doing all that I could. Yeah, so a little bit of that sounds a little bit of some of that self-criticism of just, what could I do? Should I have been able to do more? That can be really haunting for some people, of saying, is there something I could have seen or caught earlier to help me through this? Is there another treatment that I don't know about? And so over researching, and some people kind of dive into that WebMD, which can be a dangerous game, but just saying, okay, what can I do? Us as human beings, when we see a problem, we want to solve it. And so when we have a disease or an illness, or even when we're doing something as small as a puzzle or a math problem, is that we want to solve this problem. And so what can I do? What can I control to move forward and get myself well? So that's a big one. Thank you for sharing. Okay, moving on. So the third dimension of well-being is social. So social or relationship wellness encompasses how well we interact with others and the quality of such relationships as well. So others may include our partner or spouse, our children, family and friends, the medical team, colleagues, community, and anyone around us that we believe that are a part of that social network. So social wellness can include supportive and respectful relationships specifically, effective at conflict and communication skills as well, flexible boundaries. And by flexible boundaries, I mean that you're able to pair that I'm going to be open with you and be supportive and respectful, but also flexible in that I'm only going to share what I am comfortable to share. And so to have that flexibility, I think can be really supportive for individuals as we talk about relationship health and wellness. And so being kind of flexible of, okay, for this specific person, I can share these informations. For this specific person, I'm not going to share those specific details, but I still find that they are still part of my social network. So for example, there might be certain things that I might share more with my partner or my spouse than I would my children. Or there's things that I might tell my children more than I wouldn't tell my community or my faith community or my colleagues at work. So having that flexibility there. And then just spending time with others is finding those little moments throughout the day, throughout the week that you can connect with those that you want to connect with. So whether that's in person, which might be more of your immediate household now because of COVID, or whether that's virtually. FaceTime and Zoom and Skype have really come a long way for us to still have that connection with it being a little bit safer in terms of that physical distancing. So how is that impacted with living with a bone marrow failure disease? So there's several different ways that we can see how social well-being is impacted. One is a role reversal or role identity changes. So this can come up when an adult child is a caregiver for you. And so there just feels like that reversal that now you're the dependent and your child's taking more of that parental role. And so that can be really a different dynamic of now, okay, there's more that I'm sharing with my child than I used to before this. And so getting used to some of those changes. There's also changes in just the quality and quantity of relationships with others when you have a chronic illness. And so looking at, you might be divulging way more emotional issues or giving way more details in terms of your physical health than you did before you had the diagnosis. And so your quality is just shifting there. And your quantity might change as well. So whether or not you're getting more friends, more peer support through coming into the doctor's office or the hospital for treatment, and so getting to know more peers or going through AMAC and going through their group support programs and building more of connections that way. Some people might notice that there's actually a decrease in the amount of friends or social supports that they have because they're now noticing that some of their friends that they thought they were really close with now when things got a little bit tricky and a little bit more intense in terms of talking about a physical illness, that they're not quite that respectful and that supportive relationship. And so some things kind of get dropped there. But that kind of varies person to person. There's also changes in time dedicated to social connection. So this is a big thing. A lot of living with a bone marrow failure disease is spending more time resting or more time in treatment. And so there's less time available for social connection. Even we might have noticed in COVID times, outside of the chronic illness, is that just the time that we've dedicated to social connection has changed. For some people, they've never talked to their family more now that everything is virtual and there's not really too much traveling that's being able to do, and so they're connecting with people more often. Some have found that with just everything that's going on that it just doesn't feel like a good time to connect. And so the time has just shifted. And just change in social activities. So what you used to do before, you might not be doing right now. So for example, some people might have had family game night or friend game night and in person, and that's not really quite happening now because of the restrictions. Or even if your social activities have changed from getting your chronic illness diagnosis, is that maybe before your peers would go on really extravagant hikes or traveling or doing a lot of physical activities, which you're just not quite capable to do right now because of some of the symptomologies that you're experiencing. And so noticing that there's just that shift in social activities. I'm going to leave the chat open for anyone else that has noticed any other impacts to their social health while getting the diagnosis of a bone marrow failure disease, or whether they were a caregiver and how maybe caregivers specifically have noticed a shift of how that impacted, specifically their social health has been impacted by the caregiver role. So one person said finding the need to connect with other people who share the same disease. Yeah, and so finding that need and noticing that shift of, okay, I think I need someone in my corner that really has a really great understanding of what this diagnosis is and what I'm going through, and finding a little bit of a deeper connection with that. There's always reaching out to our friends and family and saying, oh, I have a diagnosis of MDS, and then you're not really quite looking for the support of educating your friends, but sometimes your friends, the first thing they ask is, what's MDS and what does that include? And so you might not have been up for an education session, you were really up for emotional support session, and that's kind of shifted. And so it's finding that need to connect with other people with the same disease who have gone through something similar, and that you don't have to do that education piece. So yes, that's a big one. I've noticed that some patients have also noticed what they call kind of information fatigue of needing to update so many people at the same time, and so finding some of that as being a little bit of fatigue as well. And so again, going back to connecting with people that don't necessarily need all those little updates at the same time. Another person said becoming a self-advocate. Yes, yeah. And a self-advocate in so many different ways. A self-advocate in terms of really reaching out and talking about those flexible boundaries of saying, you know what, like I've had enough. I've had a day that my entire day was treatment and medical appointments, and I need some time to myself. And so advocating for what are your needs and what are your wants right now. And it's amazing of how much sometimes an illness or a therapeutic issue can sometimes bring voice to our needs and to self-advocate for what we want and what we need at this time. So that's a big one, is self-advocacy. And that, you might notice, will come up in different areas of our well-being, of really how do we advocate for ourselves and our health and our holistic health as well. Yeah, excellent. Thanks everyone for sharing. So moving on to the fourth area of well-being is our intellectual. So intellectual wellness encompasses ways in which you engage in mentally stimulating activities and expanding your knowledge and understanding about a subject or a variety of different subjects. And this can be nurtured in several different ways. It can be nurtured through formal academic pursuits, so like an undergrad, or through community college courses, or it can be artistic and skill-based. So you can look at even going to a museum or doing any kind of online virtual gallery viewings as well. Or it can be skill-based. So if you're looking at kind of gaining a new skill of saying, I want to learn more about the Zoom calls now that so many of our socializing factors are gone through online platforms, is I need to learn more and build my skills in that setting a little bit more. So there's such a variety of where intellectual wellness can be nurtured in that way. And it can also be experiential based as well. And so going through this process of having the diagnosis and going through your treatment plan is thinking back of how much that you have learned and how much you have grown in terms of your just intellectual wellness surrounding your diagnosis and your physical health. So that is one thing that really has been impacted by living with a bone marrow failure disease, is that there's this increased knowledge and understanding regarding your body, your mind, and the chronic illness that you live with. I'm sure many of you, patients that have been diagnosed with the bone marrow failure disease and receiving kind of a big education pamphlet of the do's and don'ts and what do certain acronyms mean, and there's a lot of learning, and same thing for caregivers. There's a ton to learn, not only about the disease itself, but also how do you become a caregiver? What does that look like? And so also building on that experiential knowledge as well of seeing how far you've come since the very first day. In terms of some negative impacts on your intellectual health throughout the diagnosis and through living with a chronic illness is sometimes there's a difficulty in focusing and concentrating, and so a difficulty in reading and really staying in tune. You might have noticed that before you used to be able to read several books at the same time and still keep on top of the plots and how all of those moved, but as you've noticed throughout your diagnosis and throughout your treatment progression, that's just become a little bit more difficult. There's also changes in the time dedicated to areas of study. So for some people, you've been diagnosed as you were in the middle of doing graduate studies or undergraduate studies or doing a course, doing English as a second language course, and noticing that you don't have that time to dedicate to your intellectual wellness as much as you were previously as well. So that can be impacts onto your intellectual well-being through living with a chronic illness such as aplastic anemia, MDS, and PNH. Is there anything else that you all have noticed throughout either the treatment or through the diagnosis or just through the process of living with the chronic illness, of how your intellectual well-being has been impacted? It can be a little bit of a tricky well-being dimension. Not a lot of people think of really how much have we nurtured this part of ourselves and noticing, oh yeah, I guess my intellectual well-being, that is a dimension that I just didn't think of before, and how it makes me feel when my intellectual well-being is nurtured after we've read about a new subject that either is really personal to us or that we find interesting, and how we can sometimes get down that little bit of a rabbit hole. And so looking at not only are we nurturing this area of well-being, but are we also giving it some balance as well. Sometimes it can be very quick for us to get really obsessive and linked in with certain topics, and so it's okay, how do we find that balance between the two as being, yes, this is helpful research and useful research and useful knowledge, and where is it, okay, let's take a break and let's switch gears in terms of learning something different, learning something just for ourselves. Some people, throughout having a diagnosis of a chronic illness, regardless if that is a bone marrow failure disease or if it's something else, take up things that they never thought that they would. So some people took up knitting or crocheting, something to just switch their intellectual well-being of looking at, okay, what are all the symptoms and the treatments and everything that's associated with the diagnosis, and how do I learn something new that's just for me? Yeah, so that can be a little bit of a tricky one, but something to keep an eye out as well. Moving on to the fifth dimension, which is environmental. This is another one that doesn't really come quickly to mind when we talk about our holistic well-being, but environmental wellness is just the awareness of the health and safety of our environments in which we live, work, and play around. And so you can't always choose that environment that you live or work or play in. Sometimes you do, sometimes you don't. Sometimes there's shifts in that environment that make it, that kind of shift the wellness and that health and safety part as well. So if we think about a workplace, for example, and if all of a sudden there's a leak in your office, and so that kind of shifts the health and safety of it. But you can take small, controllable steps to make these environments a little bit safer. And so looking out for, okay, how can I make this environment a little bit roomier and comfier and safer? So this can include, obviously, your home environment health, recognizing the need to have people and things around you. And so, for example, if at work you're stuck in a cubicle, or you were stuck in a cubicle and you're like, this really isn't good for my health and safety psychologically, maybe you're really tall, and so physically it's not great either. So it's, how do you make those little controllable steps to make your space a little bit more comfortable? Do you put a plant? Do you put a plush toy? Do you put some ergonomic equipment to make you feel and actually be physically safer? And just being aware of those risks And so, for example, with people living with a chronic illness such as aplastic anemia, MDS, and PNH, is avoiding that public transit, now noticing the health and risk factors of going out and going on a public bus or going to the grocery store, just noticing, okay, is that the right environment for me right now? And so looking at finding those controllable steps as well. So some of these can be some changes in the way that you clean. So some people have noticed that a really big impact is that they're cleaning their houses way more than they thought or than they were before the diagnosis as well, and doing more of environmentally friendly approaches as well in terms of what cleaning products they use now that they have the diagnosis, and way that you can reduce your carbon footprint. And so what are some changes might have been that you're now taking more of an independent and personalized vehicle versus taking public transit. So it's just that change and shift as well. Is there anything else that you guys can notice of environmental well-being and how that's been an effective, or how that's been impacted by the bone marrow failure disease that you're experiencing? And yeah, someone said COVID has increased everyone's awareness of this dimension. You are completely correct. This has been a really big conversation starter as it's become into COVID, of really being aware of the germs and just the health of our surrounding as well. So yeah, not only with people living with a bone marrow failure disease, there was kind of a piece of this before COVID that you were very cautious of riding public transit and cleaning and hand washing and wearing face masks, but now it seems kind of like everyone is on that boat as well. Of course, yeah, great point. Okay, so second last is our occupational and financial. So this wellness encompasses just a variety of our work or study, making use of your gifts and skills and talents in order to gain a sense of purpose and building a healthy relationship between your goals and your financial obligations. So this can involve your occupational as well as psychological health and safety in the workplace, goal setting, skill building, budgeting, or insurance and financial assistance programs as well. So this is kind of all what encompasses our wellness as it relates to occupational and financial well-being here. Now, some people, as they are impacted by living with a bone marrow failure disease, is that there's kind of a variety. Again, it depends on the diagnosis, it depends on the treatment plan, and it also depends on what you were doing beforehand, before the diagnosis. But some have often noticed a reduction in their hours, or they've had to stop work entirely, that there's been a change in terms of what your job was, and so there's some accommodation there which has shifted what your passions were beforehand. And sometimes that's increased financial stressors if you've had that reduction in hours, and so that reduction in salary there. There also might have been a change in expenses as well. So you might be driving more, you might be driving less, there might be less travel funds, at least of what some people are noticing in terms of especially COVID. Is there anything else that kind of comes to mind as you're thinking about occupational and financial well-being as it's impacted with a bone marrow failure disease? So someone said cost of traveling for treatment. Yeah, that can be a big one, especially as you can't take public transit and it's a little bit more expensive to take a taxi ride or to take your personal vehicle as well, or even if you didn't have a personal vehicle beforehand to get that. So that's a big change. Yeah, of course, of course. And depending if you're coming from out of city as well, if you're commuting for your treatment, that can be a big one as well. Someone said caregiver is missing work, and so there's less money. Yeah, so again, that goes into reduction of hours, not only for the patient, or for the person living with the disease, but also for the caregiver themselves. There's a reduction in hours. You might have to stop working entirely depending on that treatment plan. Of course, for sure. So the last area of well-being is our spiritual. So this really encompasses a level of faith, hope, commitment to your individual beliefs and values, and provides you with a sense of meaning and purpose. So not only spiritual in terms of the organized, like an organized faith or an organized religion, but it can also just be your own personal beliefs and values. So it's really finding that harmony between what lies in yourself and what is outside. So for some people that this has been impacted, some people have found a really big impact with living with a chronic illness. in terms of it's just changed the way that they've practiced. So maybe they can't quite do their prayers or quite do their spiritual practices as they used to organize it. Some people have found a strengthening in their spirituality and more of a closeness with their beliefs and their values. Some people have noticed the opposite. So some people have found that it has challenged their spiritual beliefs and has challenged their cultural beliefs there. Is there anything that anyone wants to mention in terms of their personal experience of what has impacted their spiritual well-being, or what spiritual well-being has been impacted by a bone marrow failure disease? I find this one can really go either way, and it really is dependent on kind of what your spirituality was beforehand, and if that's ever been something that you've entertained in the past, or if it's something that you were really connected with previously, and so it's just kind of a shift on how you approach your spiritual wellness. Okay. Perfect. So those are the 7 dimensions of well-being, and I know we kind of skimmed through them really quickly, but it's just to kind of introduce you of what are some other perspectives. So going back to that elephant, we kind of looked at the trunk, we looked at the tail, we looked at the ears, we looked at all those little things, and so it's now kind of picturing, okay, now that I know that we have all these dimensions, what do we do now to bring it all together and to really support ourselves? So we are looking at kind of self-assessment, self-management, as well as self-advocacy. And those are kind of 3 pieces that we can do to really apply this knowledge and look at it and really combine it into that holistic lens and that holistic well-being approach. And you can see that the different arrows are just saying that it's not just a fluid response and a hierarchical response that we assess, we manage, we advocate, and then we're done. It's a process. This is an active process just as much as our well-being is active. You'll notice that our physical wellness will change throughout the day, and then that trickles down and impacts our emotional and social, and so it's all just our overall holistic well-being is really an active process, and so would the application of supporting it as well. So starting with a self-assessment, we have a well-being wheel handout that I tried to upload it to our chat, but for some reason it's not uploading, so it will be on AMAC's website. I'm hoping within a day or 2, but Fiona can clarify that, so I apologize if I put too much pressure on you in terms of making that quicker, but there will be a well-being wheel handout, and so what essentially you do is that this is your self-assessment, and it's specifically a satisfaction assessment, and this can be done not only for those living with a chronic illness, they can be done with the caregivers as well, and it can be done for really anyone, of just assessing how am I feeling today. Am I feeling off and I just don't know why? Like I physically feel fine, I emotionally feel fine, but I don't know what's off? Is that you can do this well-being wheel and take an assessment of, okay, what is my satisfaction with each of my areas of well-being? And 0 is being right in the middle there, and then we kind of go up throughout the lines. And so say, for example, if my emotional health, I am feeling that my satisfaction is about an 8, I would color in from 8 all the way downward. And so what you end up getting is this wheel, and you can see how well, if this was a real wheel, how smooth would it be? Is it super jagged? Am I finding like, oh, okay, I'm noticing that my environmental health is at a 2, and I wonder if that's why I'm feeling a little crummy. And so it's just taking a look at your holistic self of saying, okay, what are some things that I'm noticing that I'm not super satisfied with? And so this can help just assess where we are at. The second handout that will also be on the AMAC website is our action items. And so now that you've done the assessment and you're noticing, okay, my environmental health, that one is probably at a 2. So what are some actions that I can take to either improve or maintain my well-being in this dimension? So this handout will, let me see if I can get it up for you guys, but basically it drops down into each of the areas of each dimension of well-being, and it just has notes of just kind of tips and strategies of just some ideas of what you can do to increase your well-being in that dimension. But it's a really big question of asking yourself, what can I control? Is there some action that I can take to improve? Or is there some action I can take that can kind of help prevent this from going any lower in terms of my satisfaction. And if you notice yourself, if you're saying, there's nothing I can do, I've reached my max, there's no other things I can do to really make this satisfaction increase or maintain, and asking yourself, can I accept the status of this well-being dimension as it is for right now until there is something that I can do to improve it? And so that's where some of that acceptance piece comes in. Is that something that I can let go of right now until there is something I can do, instead of trying to fight it? Because sometimes fighting it can make it feel a little bit worse or feel a little bit heavier. And then we go into self-advocacy. So now that you've done the assessment, you've done the things that I can control, some of the pieces that you can control is self-advocacy. Someone had mentioned it earlier, being that self-advocate, of noticing, okay, where are there pieces that I can advocate for myself? There's only so much that our medical team and your support team and your support network at home that can really help you with, but there is a piece in which you have to speak up of what your needs are and what you think could be useful. And even if you don't know what could be useful, of just talking about it and saying, I need help, but I don't know what help to get. I don't know what I need. I just need something to help me. And so speaking about those symptoms, those side effects, really to your support team, whether or not that's your family, your friends, or your treatment team specifically. So talk with your doctor, your nurse, your pharmacist, social worker, anyone else on your treatment team, of expressing, these are my concerns and I feel like I need help with it, or I'm not satisfied with this area of well-being. Is there anything that I'm missing? So advocating for yourself. It's a challenge, but sometimes it can be found really strength-inducing as well. So we have about 8 minutes remaining of our webinar today. So I first want to thank you all for listening in. I know everything kind of went quite quickly. There's quite a lot of areas and different dimensions of well-being, but it's just kind of an overview of looking at it. How can we look at our chronic illness and the life that I'm living right now, of either being a treatment team member or a caregiver or a person living with a chronic illness, of how can I look at my situation beyond the physical symptoms? Are there other impacts that I'm not noticing that might be contributing to why I'm not feeling super great, or I'm feeling low, or I just don't feel like I have that support? And so it's just to kind of broaden that knowledge and understanding. So I'd like to open the floor to any questions. Fiona, I don't know if we can unmute people for those that don't want to chat in the chat feature and prefer to ask questions more verbally.
Yes. Yeah, I'll just unmute people right now, and just mention that I will email the handouts that you referred to, Nikki, to the people that are on the line, because it may take 4 or 5 days to get them all on our website, but I'll be sure to email them out to everyone.
And the PowerPoint I'll also email to Fiona as well, so you'll have the PowerPoint slides, as well as the 2 handouts that I mentioned, the self-assessment well-being wheel, as well as the action items, just for some tips and strategies to start thinking of, okay, what can I control out of this dimension in order to either improve or maintain my satisfaction.
Great, thank you. Yeah, I think it's so important to bring all these dimensions of wellness together, because our healthcare system can be really good at focusing on the physical dimension and sometimes neglecting those other parts. So it's a good reminder to all of us to pay attention to them and speak up about them.
And sometimes we there's so much change and so much that happens when recently diagnosed with a chronic illness, and especially if it's a bone marrow or a blood-related disease, is that it sometimes can feel like you're hitting a brick wall when you get that diagnosis. And so it's really kind of going into that survival mode. You look at your physical well-being first, and that's completely normal. It's very evolutionary to look at your physical well-being and your physical safety first. sometimes it doesn't hit us until a little bit later on when we've kind of started to get into that groove of getting that physical support and doing that research on the symptoms and the treatment plan. And then you're starting to notice, okay, but why do I still not quite feel myself? And so it's looking at, okay, how else has this diagnosis and how else has this treatment plan and the physical symptoms, how else have they been impacting me? And so looking at all those areas of well-being can really be an interesting tool to kind of build your awareness of yourself.
Yeah, and we find that with our patient support groups too, that people are more interested in that once they get past the initial diagnosis and, like you say, the shock and all the information seeking. And they often come to the patient support group a bit later in the process, which is fine. That's when they're ready, when it's the right time.
Exactly. And sometimes to address your holistic well-being, you need to have that space and that energy and that kind of that comfortability to reach out. And so sometimes that just comes with time, and time to not only settle in and kind of going back to when I was talking about that acceptance, is that it's not accepting that that what you're living with is okay, and that it's okay that you're going through this, or that it's deserving in any way. That's by no means of what I'm meaning by acceptance, but just accepting that this is the position you are in right now. And so instead of fighting it and to ask yourselves all those shoulda, coulda, woulda questions and some of that self-criticism, piece is saying, okay, well, if I can't change the diagnosis right now, what can I change right now? And so and sometimes that just comes with time, is creating that space and that kind of mindset of shifting gears and saying, okay, well, this is the cards that I'm dealt right now. What am I going to do with these cards? And so it's reaching out for that peer support groups that AMAC offers. It's reaching out to, there's tons of Facebook groups as well that are a little bit more informal, or it's reaching out to those friends and family, reaching out to your medical team. Sometimes it's even to brainstorm with your medical team if you're not sure, like that there's one nurse that's a good go-to person for a lot of your physical concerns, but you're not sure where to take it for another concern you have. And sometimes it's always worth just checking in with that one person you trust and that you feel that respected relationships with, and you ask them. And it's amazing how resourceful your medical team can be, even if it's not them specifically that will be giving you that support.
We do have a question. Can you see it, Nikki? You sort of answered it, I think, but
I don't see it. Did it come through?
It's where can I get this kind of support treatment? My doctor doesn't have the time to talk about things other than my physical health.
So you can ask your doctor if you're specifically looking at a certain dimension. So say, for example, if it's emotional well-being, of asking them, is there a counselor, a local therapist, or is there a program that you could recommend anyone for emotional support? And so even though they don't have the time to offer you that support specifically, sometimes they do have, like we have our coping skills and our kind of toolbox of resources that we go to, our medical team often does as well. And so sometimes when there is that fast-paced environment of a doctor coming in for appointments, sometimes you need to bring up some of that self-advocacy work and saying, this is what I'm noticing that I'm needing. Is there any resources that you know of that could be supportive in this way? And so the worst thing is he says he doesn't know, but he could pin you or point you in the right direction of someone that does. So you'll never know until you ask. And so that would be kind of your first step of asking that general practitioner or that doctor that's within your treatment team to see if they have any recommendations. And sometimes it's worth reaching out to those peer support groups. And so not only with AMAC's peer support groups of just having that emotional support or that peer-to-peer support, but it's also to navigate some of the resources. Has anyone found a resource on coping with environmental health concerns? Or is anyone noticing that intellectually I need something stimulating debilitating and I need it now and I don't know what to choose. And so some of that peer support is reaching out for holistic well-being resources and more of that practical support as well. So it's trying out those different avenues to get the support and just experimenting with, okay, who in my support network, who do I know that possibly could have those resources or could point me in the right direction of someone that does.
Great, thank you.
Question.
Any other questions? Anybody want to ask their question out loud? All right. Well, with that, I want to thank you very much, Nikki, for the presentation and for providing us with the handouts. And Nikki also kindly did a bit of a summary of her presentation for our next newsletter, so you can read more about the 7 dimensions there. So thanks for doing that, Nikki. And thank you to everyone who joined us today. I just wanted to let you know that our next webinar is on Saturday, May 29th at 1 p.m. Eastern Time. And the topic is an introduction to cytogenetics and molecular testing in MDS. So if you'd like to attend that, please register on the AMAC website. And you can also go there to find out about our virtual patient support groups, which happen across Canada. And you can also register on the website for those. So thanks very much, everybody. And I wish you all a pleasant afternoon and evening. And we'll see you next time. Thank you.
Thanks everyone.
Bye-bye.